This is a special edition of FHCA's Provider Program.
Welcome to the first meeting. Definitely we all look forward to working together on several important issues that will be coming before this committee. Healthcare is always an important topic, and funding healthcare seems to be more important sometimes than the actual healthcare itself. Okay, seeing no questions, next up we're going to have Justin Senior. Justin Senior is the Interim Secretary of the Agency for Healthcare Administration.
The goal that is set in the program is that we would put incentives in the way that we paid managed care plans that would incentivize them to move 2% or 3% of their population from the nursing facility and into home and community-based settings per year. That's in the statute, and we've structured the rates that way to allow these folks to move from a nursing facility and into the community. There's a lot of savings associated with that, and there's a lot of consumer satisfaction that is associated with that. Madam Chair, there actually is a statutory framework. I think they're required to be paid. They're required to pay clean claims, I want to say within 10 days. I can get you the specific site on that and the specific number. The word clean claim, the devil's in the detail there. But I think that it's fair to say that we are 100% committed to making sure that the plans comply with their prompt payment obligations, and that they don't play games fast and loose with the definition of clean claim.
Good afternoon, Madam Chairman and the members of the committee. My name is Julie Kemman. Today I'm here representing Florida Healthcare Association and our more than 550 member nursing centers across the state. I would like to provide some information regarding the outstanding payment issue providers are experiencing as it relates to managed Medicaid billing. Florida Healthcare Association has recently collected data from 237 providers, which represents over a third of the providers in the state. The findings of that data speak to the issues surrounding timely payment of Medicaid claims and Medicare coinsurance. On average, providers have over $200,000 in outstanding payments from Medicaid managed care companies, of which $86,000 is over 90 days past due. If you take that per facility average and extrapolate it statewide, it is a shortfall of $135 million statewide. As you can imagine, these payment delays are very problematic for a profession that deals with slim margins and Medicaid rates that are currently underfunded by almost $14 per day. Prior to implementation of Medicaid managed care, when the state was responsible for paying claims, providers submitted claims in a single system and could count on receiving payment within 10 days. Current statutory language requires that managed care plans pay electronic claims that contain sufficient information for processing, in other words, a clean claim, within 10 business days of receipt. But as you can see from the data Florida Healthcare has collected, this is not happening. Providers are having to adapt to different billing procedures and requirements that are unique to each plan. One plan is on their third claim submission website in a few years, which creates problems for providers who have claims unpaid in the old system. That cannot be billed in the new system in some circumstances. In addition, during the interim periods between system transitions, providers often have to submit or have had to submit paper claims, which require additional workload and staff time for the providers. Nursing home budgets are a zero-sum game. Every additional dollar a provider has to spend working on collecting or resubmitting claims multiple times is money that can be spent on improving quality of life for our residents. Statewide, providers are having to hire additional billing staff or hire companies like mine that are providing billing support to use those limited funds on getting paid versus providing additional services. Thank you, Chair. Chairman.
Yep, Senator Pasadomo.
I have what might be a very simplistic question. When you are contacting the managed care companies about payment, what do they say to you in response to their lack of timeliness, the reason for not paying timely?
Madam Chair. The way that we are handling it in many cases at this point is as a claims project. We obviously try to work directly with the plans prior to making a complaint. And so that has become quite popular, is to handle something as a claims project, which basically means multiple residents are being put on an Excel spreadsheet, and we're trying to work through in that regard. Sometimes it's a case by case, but that has become quite popular.
Yeah.
Even if it's a case-by-case basis, there's got to be a response. I mean, this is very simplistic. So are they saying, well, you didn't provide enough information? Are they saying, oh, well, you know, we didn't get paid today ourselves? Are they saying your claim's bogus? I mean, what you must be having a conversation, because it's such a divergent perception.
Madam Chair. It really runs the gamut on what the issue is. There was a period of time recently, within the last 3 months, that one particular plan, the claims were submitted on the website. They showed as validated and being received. The next day, they were gone into a black hole. This happened 3 consecutive times. Each day, it was tracked and followed up on. So that's one example that it's their website challenges. Some issues have to do with an enrollment update. You know, there's a whole variety of possibilities, and we've been collecting some of that data as we help our clients.
Thank you very much. Next is Deborah Franklin from the Florida Healthcare Association.
Thank you, Madam Chair. Good afternoon. My name is Deborah Franklin. I'm with Florida Living Options, a not-for-profit organization that operates skilled nursing centers, assisted living, and independent living facilities. I'm here on behalf of Florida Healthcare Association, which represents over 82% of our state's nursing centers. Florida's nursing centers now, just to educate you a little bit, that we have 2 type plans. We do short-term rehab and long-term. And so I need to make sure you understand that and understand what we're talking about. I'm here to speak with you about Florida's managed care, long-term care system, not to tell you that the entire system doesn't work. Rather, managed care does work in some areas. For example, it works for individuals needing home and community-based services and those individuals who don't require long-term stay nursing care centers. We're caregivers. We want the best for the patients, the residents, and the tenants that we take care of. The best for them is to ensure that the people we serve and care for are in the safest and most appropriate setting. And if there's an opportunity for them to return home, we work hard to make that happen. From day one, we start discharge planning. That's not what you hear most of the time. Day one, we start discharge planning. We want to make sure what's best. You want to go home? We're going to see what we can do. We help with the financial. You need an advocate to see if you can get on Medicaid, whatever you need. And then we meet with the case manager and say with the managed care, you know, Mr. Jones can probably go home. His neighbor can help him. He has no family. But if we get Meals on Wheels set up and we get other services, the transportation, but the problem is his electricity's been turned off. He doesn't have a deposit to put it back on. He needs a ramp that would help him because he can't get up the stairs. And then together, not the incentives for the Medicaid plan, together, we help get them into the community, back into home, back into assisted living, whatever's the best for them. For our short stay residents, we are continuously working with the managed care plans to safely transition them back to the community whenever it is most appropriate. But for the long-term stay resident, meaning those who can't take care of themselves are safely be cared for in the community, we don't believe the managed care system is working properly, working effectively. There are no savings associated with paying managed care companies an administrative fee to manage for long-term care residents. When an individual comes to our center, the Department of Elder Affairs CARES team determines if that individual is deemed to be long stay. This process has not changed under the managed care system. However, in addition to CARES, the managed care case manager will conduct a similar assessment to make that long stay determination. This involves bringing staff and family members back together to repeat the process with the managed care case manager to affirm the decision that CARES has already made, that this individual will be with us long-term and cannot safely be cared for outside of the nursing center. This is a redundant process and an added cost to the state, and it does nothing to enhance the coordination of care for our long-term care residents. We've also experienced a number of challenges with payments, from having to manage multiple systems for submitting claims to the different managed care plans and delays in getting paid for those claims. I have had to, personally, for 3 skilled nursing facilities, I've had to hire one full-time person that does nothing. This is one stack of emails for one claim for one provider. That money has come out of quality of life. I'm going to make sure my residents get care, but we're already underfunded, so I had to pay a full-time staff. I've got to take it out of quality of life somewhere, whether it be an activity as aid. Managed care plans are often late in paying these claims. This stack of papers represents one resident alone. It's about $45,000. And all in total, I'm awaiting $404,000 in outstanding payments. I'm a not-for-profit provider. Goes right back into resident care. $404,000 that we're waiting on that could help in resident care.
Just quick question on that. Walk me through, how does AHCA know about this? Are you on the chart?
Here's what happens on the complaint lines. I was on the chart multiple times in the beginning. You file the complaint, AHCA notifies the managed care plan, and the same person that I've been dealing with calls me. So if I have time to work on the claim or file another complaint with AHCA that's not getting taken care of, what am I going to do? So I'm in the very beginning, the first year or so, and then other, we're caregivers, we're going to make it happen, and so I will call contacts that I know, and such as Tom Parker and stuff, to help to try and get things solved.
One more quick question. Do you all participate in the Maximus thing? And if not, why not?
To be honest with you, today's the first I've heard of it.
Okay. Vice Chair Sargel.
Thank you, Madam Chair. So in the conversation that we had earlier, I understand possibly the incentive to trying to get people to, arguably, I guess, were more nursing homes and that wasn't the best care. Now we're getting them to community-based. But as we've moved to that, and that seems to be working as a process, do you see the benefit of keeping that system and then keeping the payment structure that we're using for the long-term care, like you said, once they're now basically committed to a nursing home and there is no other option that's best for them?
33 years of doing this, and what I can tell you has happened is that with the Medicaid managed care, it allowed the continuum of care, that there were payment sources that we could assist in getting people into the community, and that's why I believe that we saw an increase in people staying in the home, the community, because we then had the payment source. So I personally do not believe the incentive has been what has been driving this, but because the continuum has now been available.
Senator Book?
Hey, how do you go about determining if a resident is going to be a long-term or short-term resident, and how long does it take to make that assessment?
Every resident is, person-centered care is different. You may have someone that is admitted with a fractured hip and everything goes smoothly, and you start discharge from day one, this is our goal, and it moves on. And we can follow through the goal. You may have someone that has a fractured hip with some other comorbidity issues, a heart attack or other things going on, and there's complications and through the process. And it takes usually safely between the 30 and 60 days. You can know for sure with the disease process going on with a resident, whether we're going to be able to get them back out in the community or not.
Great. Senator Artiles?
Thank you, Madam Chair. Now, my question is not so much for the managed care system, but is it specific providers that owe you this amount of money? Is it one, two? Is it all of them? That's very important, because to attack an entire system because of a provider's failure to pay or failure to pay on time is a little.
I will tell you, this folder is one provider. It will be issues that you go on. We had one provider that was paying, everything's fine, and for 3 months they just totally stopped. so there's no method to the madness. There's one provider that has, I would say, the shining star out of the rest of them, that has worked well with us and, works well to work things out. And then you'll have ones like this one that no matter what, you can't get it done.
Yep.
Do you believe that the communication setup or the system set up by that number one superstar providers is something that if it were implemented to the other providers, that their payment schedule and or response to vendors such as yourself would be much better? In other words, look at a system that actually works very well and then try to mimic it with the different providers instead of just blowing up the entire system. Don't you think that, my question to you is, wouldn't you think that taking that provider's way of doing business and replicating it with the other providers would basically make things a lot smoother for you to get paid on time and to increase vendor and provider relationships?
Madam, well, for instance, in the law for instance, we pay a bed tax. The law says I will be fined if I don't pay when I'm supposed to pay the fee to the state of Florida. But to the managed care companies, it says may. They may get fined if they don't pay us within the 10 days.
Hey,
So,
thank you. Thank you very much. Thank you.